Hello, my name is Rob Caturano. I'm the physical therapy manager here at Orthopedic Institute of Western Kentucky. Today we're going to talk about those little knots, those muscle knots that you get where you feel like, man, I need to rub that out or work that out. I want to talk to you about where they come from, what they are, what we do about it. So first thing you need to know, it's kind of a multifactorial problem. There's a lot at play there. You have nerves that supply input to muscles that get tense, and you have fascia that holds this stuff in. I'm going to show you an example of fascia in this text here where we've got a cadaver diagram with no fascia involved, and then this one on the left, there's the fascia that covers that. And this goes throughout your body. And when the fascia gets inflamed, it can become fibrotic, meaning what should be pliable and flexible now is rigid and stiff, and little nerves get caught in that, and the muscles are sensitive to it, and they get tensed and tight, and you wind up with these knots. In therapy, we do a couple things. One, we try to loosen that scar tissue up, the scarring in the fascia, and that connects to the muscles and nerves. And we'll use our hands or tools to do that. I'm going to demonstrate that in tools today. We're going to work on Cassidy's calf muscle, and we're going to just try to loosen the fascia and muscle up on her calf. And then we'll talk a little bit about what else we have to do to augment that treatment. So let's go over here to Cassidy. This is one of the tools that we use. This is called ISTIM, short for Instrument Assisted Soft Tissue Mobilization. A couple things. When we use that, we're kind of protecting our hands instead of using them all day long. But secondly, it helps us, it makes it more sensitive to little knots and rough spots in that fascia and muscle belly, so we can feel where we need to emphasize. It looks like this. As we're doing this, we have some gel that we use these little popsicle sticks to scoop out some gel, and we put it there on the affected area, and we use this tool just to rub that out, and it's like digging in and getting a good deep massage, and we spend some time over the treatment area. You can see that tissue moving around. And when we do this, if I keep this relatively flat, I'm not digging in as deeply. If I come at a steeper angle, you can imagine that would be a little deeper. I'm not pressing hard with my hands, I'm kind of letting the tool do the work. But at times, if you rub this across the muscle belly, you'll feel this little clunk, clunk, clunk. You'll feel a knot, and you want to spend a little time on that to just try to loosen that area up. As we get more and more pliable, you can literally feel the difference there. Now, I will warn you, most of the time, people feel better when we're done with this treatment. But typically, it's a temporary relief, and that's because of all these factors that play into this. If you have an area that is getting inflamed, that's going to kick off this whole process where the fascia gets fibrotic, and you'll have muscle tension increase, you'll have painful areas because these nerves are just bound by this fascia, and you'll have just tightness in the muscle. So to really get permanent results, we would have to stretch the muscle afterwards and make sure we're strengthening it so it doesn't get so fatigued that it inflames during normal day-to-day activities, because the inflammation is our enemy with this. And you can see in the diagrams that this fascia is all over your body, and if it gets inflamed anywhere, this can manifest itself with some tension up in your shoulders, shoulder blades, your thigh, your calf. It's everywhere. So anything that's inflaming, like a repetitive task at work or playing a sport, working out too hard, that's where you're prone to develop these little inflammatory knots, for lack of a better word. And in and of themselves, they're not that serious, but they sure can hamper performance and make you feel miserable. So we try to get rid of them. We'll get that temporary relief, and then in the long range, we try to make sure they don't come back.